Before 1,000-pound sister star Tammy got a facelift and had excess skin removed from parts of her body after losing 500 pounds, she was very anxious. Hopefully, changing her face and figure has been positive for her. Sure, she wanted to tighten up her skin, but she was used to seeing a certain woman in the mirror. Now, once again, she must deal with a drastic image change. While Tammy's weight loss journey's been amazing, her self-esteem wavers. One day, she might feel proud of how she looks until someone puts her down online, making her question her own appeal. What's often unsaid is that Tammy looked beautiful before she opted for skin removal surgery. She had completely revamped her face and body, and she was having fun with clothes, hair, and makeup. Sure, there was loose skin, but that wasn't the most noticeable thing about Tammy. What stood out was the peace in her eyes, the light and the heat and the happiness. After turbulent years when her frustration with her weight and mobility issues made her temperamental and self-destructive, Tammy found herself. Now, after getting used to being 500 pounds thinner, it is time for another change. Tammy is a reality queen, but she still has vulnerable moments. There are times when she worries. Before her operation, she talked about the prospect of having surgery, and her eyes welled up. Tammy looked like she was going to cry. Surgery is a scary thing. It's normal for people to feel intense fear before going under the knife. Before this milestone in her weight loss journey, Tammy didn't have the easiest journey, but that's what makes her special. Without all that suffering, her victories wouldn't have the same resonance. Tammy weighs 225 pounds, but her weight was once 725 pounds. Being very heavy made her uncomfortable. She's been heckled. Now, a new woman is rising from the ashes. Slimmer and fitter, Tammy's bone structure is emerging. Her features seem more distinct. However, getting there hasn't been easy. As per a People exclusive, Tammy was seriously freaking terrified before her surgery. The operation lasted 8 hours, and excess skin was removed from an array of body parts: the lower abdomen, chin, and arms. In total, 15 pounds of skin was removed. After the procedure, recovery was probably an intensely uncomfortable experience. Incisions must heal, wounds may ooze, and need drainage. It's a painful and grueling process. However, the light at the end of the tunnel was Tammy's post-op glow-up. The night before my surgery, I was seriously freaking terrified. I was even more nervous about having skin removal surgery than I was for the sleeve gastrectomy surgery, because they're actually cutting the whole belly. That being said, these procedures were extreme. Yes, Tammy looks wonderful, but she's had to live with significant pain to get where she is now. After a skin removal procedure like Tammy had, it takes weeks to feel better. Pain lingers, and it's hard to climb stairs or do other everyday activities. Mobility's always been an issue for Tammy. She's been very frustrated by her inability to move freely. While she's danced on TikTok, she's also been afraid of participating in certain physical activities, such as going in the water at the beach. Tammy is triggered by her mobility problems, and after her operation, she may have felt trapped in her body again. For her, that could bring a lot of psychological turmoil. Tammy has had meltdowns because it was hard to move. So, post-op recovery may have intensified her fears. Also, she must adjust to a new face and body, and even more importantly, Tammy must deal with the opinions of others. Yes, she's beautiful, and that beauty was hard-won. However, not everyone who visits her Instagram is going to appreciate her. Some will be mean, and the truth is that her self-esteem can probably still be negatively impacted by trolls. If they can't criticize her for having loose excess skin, they will find something else to complain about, and she will feel it. So, when is enough? Enough. When does the makeover end and living begin? These are tough questions. On the one hand, Tammy needed to get the excess skin removed. On the other hand, it's always possible she'll gain weight again and then need to repeat the whole process. While every good person wants a happy ending for this woman, life is complicated. Tammy could stop dieting, gain weight, and then deal with having excess skin again. That could be traumatic for her. If Tammy's happy now with this huge change, then the surgery was worth it. The pain and the mobility issues and the fears before the operation, all of those things were worth it. See a clip on her surgery journey above via Tammy's Instagram. However, it really depends on how she feels now. What she sees in the mirror is now closer to the filtered ideal she presented in the past. Tammy has got the look she's been wanting. However, a lot of very beautiful women have been unhappy. One example is Marilyn Monroe, who was iconic due to her luminous skin and all-American look. Marilyn did not have a happy ending. Clearly, there is more to happiness than what's on the surface, a lot more. Tammy knows this. Even after losing 500 pounds, an amazing feat, she was called out for not being perfect enough. The people who put her down had never walked a mile in her shoes. They would mercilessly criticize her even though she's admitted to having very dark thoughts in the past. They wanted to push her buttons and always reminded her that her teeth or her skin quality were not up to their standards. What Tammy needs is to believe in her own beauty, as every woman is beautiful. Makeup is not required, more changes are not required. The image choices that Tammy makes should come from the heart, from a place of joy. Makeup shouldn't be a mask, but a celebration. The same with fashion. It's not to hide in clothes, but to enjoy them as a means of self-expression. Tammy has gained confidence, and now that her excess skin is gone, she may feel like she's done enough. It's for her to say if her weight loss journey is really complete, and hopefully, she does see the beauty that's right there on Instagram, whether they compliment her or not. It's time for Tammy to really live to luxuriate in a body that's carried so many burdens and experienced so much pain. Part of the reason why Tammy's results seem so extreme is the fact that facelifts need time to settle. At first, they seem very tight and may even seem a little too tight. However, later on, gravity hits and the look changes, becoming a bit looser and more natural. It can take 6 to 12 months before a facelift really settles. It's time for her to love the skin she's in and really treasure herself. If not now, when? Living for Instagram approval might harm Tammy's self-esteem. For many people, it can be that way. If 1,000-pound sister's Tammy's strong enough to handle her haters and appreciate her own unique beauty, which is like no one else's on earth, then everything she's done to get to this point is a good thing. Tammy Slaton, one of the stars of TLC's 1,000-Pound Sisters, has undergone a staggering transformation after losing over 500 pounds in her weight loss journey. Following her dramatic weight loss, she opted for excess skin removal surgery, which included a facelift procedure to eliminate sagging skin around her chin and neck. The results, revealed in the June 10, 2025 season finale, left fans and critics divided, some praising her transformation, while others questioned if the changes were too extreme. This in-depth analysis explores the medical necessity of Tammy's skin removal surgery, the psychological impact of her transformation, public and expert reactions to her facelift results, the risks and realities of post-weight loss plastic surgery, whether her results were too drastic or a natural outcome of her journey. By examining before and after photos, surgeon insights, and Tammy's own emotional response, we assess whether her dramatic change was medically justified or an aesthetic overcorrection. 1. The medical necessity of Tammy's skin removal surgery. A. The physical burden of excess skin after massive weight loss. After losing over 500 pounds, Tammy was left with significant loose skin, particularly around her chin, arms, abdomen, and thighs. Excess skin after extreme weight loss is not just a cosmetic issue, it can lead to chronic rashes and infections due to skin folds trapping moisture, mobility issues, as heavy skin flaps can restrict movement, back and joint pain from the extra weight of hanging skin, difficulty fitting into clothing, leading to further self-esteem struggles. Dr. Peter Rubin, Tammy's plastic surgeon, emphasized that skin removal is often medically necessary for patients who have lost massive amounts of weight. He noted that Tammy's 15-pound skin removal, including facial skin, was a standard procedure for someone in her situation. B. The facelift component. Why Tammy needed facial skin removal. Unlike traditional facelifts for aging patients, Tammy's procedure focused on removing excess skin caused by weight loss. Before surgery, she described her chin skin as a hanging ballsack and her arms as having bat wings, terms that highlight the severity of her condition. Her chin and neck lift involved removing loose, sagging skin to redefine her jawline, tightening underlying tissues to prevent future sagging, reducing strain on her neck muscles, which had been weighed down by excess skin. Dr. Rubin explained that facial skin removal is common in post-bariatric patients, as the face often loses volume unevenly, leading to drooping skin and an aged appearance. Psychological impact. Tammy's emotional reaction to her new face. A. Initial shock and adjustment. When Tammy first saw her reflection post-surgery, her reaction was a mix of awe and disbelief. She uttered, "Boy," while staring at her face, later admitting, "I feel so weird. My bat wings are gone." In follow-up interviews, she expressed happiness at no longer seeing sagging skin, disorientation at her new reflection, stating it would take time to adjust, relief that she finally looked halfway normal. B. The role of body dysmorphia in extreme weight loss. Tammy has long struggled with body image issues, even after losing weight. Before surgery, she admitted, "I have even more insecurities now because of my loose skin." She feared looking unnatural after surgery. This is a common psychological challenge for weight loss patients, as rapid body changes can distort self-perception. Some critics argue that Tammy's drastic change may exacerbate dysmorphia, while others believe it was a necessary step for her confidence. 3. Public and expert reactions. Were the results too extreme? A. Fan responses. Praise versus concern. Supporters called her transformation stunning and inspiring, celebrating her hard work. Critics questioned if her face looked too tight or overdone, comparing it to celebrity plastic surgery fails. B. Medical professionals weigh in. Dr. Rubin defended the results, stating, "Tammy's outcome is typical for massive weight loss patients. Swelling can make early results appear exaggerated, but the face settles over months. The goal was functional improvement, not just aesthetics." C. Comparing Tammy's results to other weight loss transformations. Other reality stars, like Christina Ashton Gorkani, Too Large, and Amy Slatton, Tammy's sister, have undergone similar procedures. However, Tammy's facial changes were more noticeable because she had more severe skin laxity due to her higher starting weight, 725 pounds. Her chin and neck skin removal was more extensive than typical facelifts. 4. Risks and realities of post-weight loss plastic surgery. A. Surgical risks Tammy faced. Infection and poor wound healing, especially since she had to quit vaping before surgery. Scarring and nerve damage, which can affect facial expressions. Need for revision surgeries if skin stretches again. B. Long-term maintenance. Tammy must maintain her weight to prevent new sagging. She may need additional procedure like arm or thigh lifts in the future. 5. Final verdict. Were Tammy's results too extreme? No, it was medically necessary. Her facial skin removal was functional, not purely cosmetic. The extreme look is temporary due to post-op swelling. Most massive weight loss patients undergo similar transformations. But it's understandable why some viewers were shocked. Reality TV exaggerates perceptions of change. Facial changes are more noticeable than body contouring. Tammy's emotional adjustment period may make her appear less comfortable at first. Tammy Slatton's skin removal surgery, including her facelift, was a medically justified step in her weight loss journey. While the results may appear drastic to some, they align with standard post-bariatric procedures. The real success story is not just her physical transformation, but her emotional resilience in facing her fears and embracing her new self. For fans wondering if her results were too extreme, the answer lies in understanding the medical necessity behind them, not just the visual impact. As Tammy herself said, "It's gonna take a while to get used to seeing myself like this. And that's perfectly okay."